and welcome to this Journal Club taping. My name is Jeannette Hart, and I am practicing in Washington State as a PA at Kadlec Regional Medical Center, and I'm a proud co-owner and co-founder of PNW Arthritis and Rheumatology. We'll be discussing the journal Sarilumab for relapse of Polymyalgia Rheumatica during glucocorticoid taper. We'll look at the SAPPHIRE trial, which led to the FDA approval for Sarilumab for the treatment of PMR. This was published in the New England Journal of Medicine in October 2023. Before looking at the study design and the results, let's talk about PMR. More than half of the patients with PMR have relapsed during their glucocorticoid taper. Patients with PMR who have relapse while tapering glucocorticoid therapy or who have adverse events while taking glucocorticoids have limited treatment options. Earlier studies suggest that IL-6 blockage may be clinically useful in patients with PMR. There also have been noted to have circulating elevated levels and increased tissue expression of interleukin-6 identified in patients with this condition. Sarilumab is a human monoclonal antibody. It binds to IL-6 receptor. The aim and the purpose of this study is to determine efficacy and safety of Sarilumab for the treatment of PMR. The funding for the study is by Sanofi and Regeneron Pharmaceuticals. Let's talk about inclusion criteria into the study. Patients had to meet the 2012 classification criteria for PMR, which is a scoring system looking at morning stiffness greater than 45 minutes in 2 locations, hip pain and limited range of motion, negative rheumatoid factor and CCP, a sense of other joint pain, and ultrasound evidence could be used for subdeltoid bursitis, biceps tendonitis, synovitis in the shoulder and the hips. To be included, they also needed to have greater than 1 recent flare during the glucocorticoid taper on 7.5 milligrams or more per day of prednisone or its equivalent within 12 weeks before screening. They had to have history of at least 8 weeks of greater than 10 milligrams a day of prednisone or dose equivalent, and a SED rate of 30 or CRP of 10 within 12 weeks of screening. Exclusion criteria included inflammatory arthritis, GCA, and rheumatoid arthritis. This is a phase 3 double-blinded, multi-center study, including 60 sites in 17 different countries. It's a randomized control trial. The patients were assigned in a 1-to-1 ratio for a 52-week study. Baseline glucocorticoids were 15 milligrams a day for the 2 weeks ahead of the study, just to ensure there was adequate control of the disease. There were 2 arms to this study, the Sarilumab arm receiving 200 milligrams every 2 weeks, plus a 14-week glucocorticoid taper. The dose of Sarilumab could be reduced to 150 milligrams every 2 weeks for neutropenia, thrombocytopenia, or elevated liver enzymes. The second arm was placebo injected every 2 weeks, plus a 52-week glucocorticoid taper. Patients were assessed at 2 to 4 week intervals initially, and then every 8 weeks and till the end of the study at week 52. Patients were then assessed at week 58 and 6 weeks following the end of the study. Patients who did not have disease remission or who had disease flare within the initial 12 weeks were allowed increase in their prednisone up to 5 milligrams a day with the blinded taper. If an add-on prednisone was discontinued before week 13, the patients could continue in the trial. However, patients given glucocorticoid rescue after 12 weeks were deemed to have no response and negative outcome in the study. For both arms, methotrexate was allowed, and patients could be on less than 15 milligrams a week as long as they were on that at the beginning for at least 3 months before baseline. Few patients were on this. However, there were 5 in the Sarilumab arm and 10 patients in the placebo arm. The primary endpoint is sustained remission at 52 weeks. Sustained remission is defined as resolution of signs and symptoms of PMR by week 12, sustained normalization of the CRP level, and absence of disease flare. Flare was defined as reoccurrence of symptoms or elevated ESR from active PMR, resulting in the need of a rescue glucocorticoid dosing. Adherence to the prednisone taper was also a primary endpoint from weeks 12 to 52. Secondary outcomes that were evaluated included each of the components of sustained remission, cumulative glucocorticoid dosing, time until the first disease flare after clinical remission, and of course, safety. The results. There were 280 patients that were enrolled, which was a smaller study basically because of COVID. So enrollment was capped at a certain time because of COVID pandemic. A total of 78 patients completed the treatment, 42 in the Sarilumab arm and 36 in the placebo arm. Their primary endpoint, again, was the 52-week sustained remission or sustained remission at week 52, and 28% of the Sarilumab group did achieve this versus 10% in the placebo group. This was a difference of 18% with a p-value of 0.02. Secondary endpoints, the average cumulative glucocorticoid dose at week 52. So for the Sarilumab group, the average cumulative dose was 777 milligrams versus placebo at 2,044 milligrams at average glucocorticoid dosing. Again, p-value here was statistically significant at 0.001. The most common reason for trial discontinuation was adverse events in the Sarilumab group, 7 patients, and lack of efficacy in the placebo group, 9 patients. The most common adverse events with Sarilumab as compared with placebo were neutropenia, 15% versus 0%, arthralgia, 15% versus 5%. More treatment-related discontinuations in the Sarilumab group than with the placebo group, 12% versus 7%. No response was defined as did not have remission or received rescue therapy of greater than 5 milligrams of prednisone within the 12 weeks of baseline. If they received any glucocorticoid rescue therapy during that 12 to 52 week period, or if they discontinued treatment before week 52. The conclusion of this study was that Sarilumab showed significant efficacy in achieving sustained remission and reduced the overall glucocorticoid dose in patients with a relapse of polymyalgia rheumatica during glucocorticoid tapering. I hope you've learned something and enjoyed this journal club. And if you have any further questions, you could log on to the WRAP website or the WRAP app. Thank you.